And June is Alzheimer's and Brain Health Awareness Month. Most Americans are concerned about cognitive decline as they age, but Black Americans are twice as likely to develop Alzheimer's, and it often goes undiagnosed until it's too late. Well, this weekend, Neurogen Biomarking, in partnership with Insight and Linus Health, is hosting a Capturing Memories Community Brain Health Day. Joining us now with more on this event and why it's so important is Dr. Rany. Everyone knows him by Dr. Rany. Dr. Rany Aburashed, award-winning neurologist and the Chief Executive Officer of Neurogen Biomarking. Thanks so much for joining us, Dr. Rany.
Thank you for having me. I appreciate it.
Yes, so before we get to this weekend's event, let's talk about this cognitive decline. It includes dementia and Alzheimer's disease, and it can start long before you start seeing outward symptoms of it. Is that correct?
Yeah, so it's a great point. So the way that I explain it to people is Alzheimer's whispers for the better part of a decade, and then it screams. And when it screams is typically when you'll come and try to see me. You'll say, I want to go see a neurologist now, or mom's not right, or dad's not right. The problem is that if you come to see me when it's screaming, it's essentially too late for me to treat you. So we end up in this really difficult spot where early diagnosis means that we actually can intervene and help prolong the disease and make it more manageable. But you end up with 92% of people in this country that are not catching it when it's whispering. And so that was really the problem that we set out to solve with Neurogen Biomarking. And it was complex, but we've built a beautiful ecosystem to do that.
As the brain is complex, so
yeah.
yeah. So why do you think Black and brown people are more susceptible to contracting or coming down with dementia and Alzheimer's disease? Yeah,
so African Americans make up about 13% of the general population, but about 20% of the Alzheimer's cases. So there's a huge disconcordance there. And the reason for that, I think, is multiple things. One of them is that if you're developing Alzheimer's and you also have diabetes or high cholesterol, or you smoke or you drink or you're not socially active, all those things can actually exacerbate it. So it's actually a part of a larger problem in the healthcare disparities that we see, where I think the African American community is not being cared for as early as they should be in a lot of these conditions. And so it's a huge challenge that needs to be met because Alzheimer's as a whole is going to, causes issues at the personal level, at the family level, and then at the governmental level, because financially we can't withstand the current trajectory that we're on.
Yeah, and listening to you talk about the susceptibility of African Americans and dementia or cognitive decline, we hear a lot of people in health and public health talk about social determinants, and it seems like that also has a lot to do with when you're talking about your social behavior.
Yeah, absolutely. So you're only as good as the care that you can receive within your environment. And unfortunately, there are disparities in this country. We're the greatest country on earth, but when it comes to healthcare, it's not the same in 2 cities or 2 counties or 2 states. And so I think it's a challenge that all of us have to sort of first understand and say it's there. And then, as we build systems, make sure that we take that into account to democratize healthcare. There should be no reason that someone in one zip code has access to something that someone in another cannot.
Right. How can people take control of their brain health?
Yeah, I think it's so essential, to first of all, don't be scared of it. So one of the things I think people worry about with Alzheimer's is, I don't want to know if I'm going to get it. But the reality is it's the same as detecting an early cancer. Right? So would you rather know you had cancer at stage 1 or stage 4? And it's the same thing with Alzheimer's. And so with Neurogen, what we do is a blood test called p-tau217. It gives us a microscopic picture of a protein in your blood that later on may develop into Alzheimer's dementia. Now, we combine that with a cognitive test, so we see where you are at baseline. And if you are progressed, then we're then able to treat you up to 5 to 10 years before you otherwise would have ever came into my office.
When it's whispering.
Absolutely, and that's the only time that these treatments are effective. So we built the system to handle that nuance. We have the neurologists on the back waiting, should you be positive. Our neurologists are trained in this, they understand the innovation, and there's very few people in the world who really understand the science at this stage. It's a very small proportion. And so we we love what we've built, and on Saturday in Flint, we want to give back as we go towards our national launch in 2 weeks. We will be doing an event in Flint. There are very limited spots left at this stage. So we have about 200 people that were allowed in. I think last I checked walking in here, we're at 174. So I would urge the listeners to go to www.mybrainday.com. Again, mybrainday.com. You do have to register because there's a $500 value to this, but we are offering it for free to this community. And also, for us, Insight incubated our company. Insight here in Flint is the reason that Neurogen was able to fly. And so as a show of appreciation, we want to give back to this community and communities that Insight supports.
Yeah, and tell us very quickly about the event you had in Chicago, very similar to this one, and what some of the results of that event.
Yeah, it was incredible. So we did this in Chicago last month. 200 people were tested. We ended up seeing about 39 positive patients. All 39 of them were still active in the workforce. They all had high-level positions or really good jobs and took care of themselves. Those patients now, 4 weeks later, are in the pipeline to going on treatment. Many of them to going on treatment. Many of them were in the lifestyle pathway. Some of them are looking at clinical trials. Now, these are people that, as a neurologist, I wouldn't see, Dawn, for probably 10 more years. Right. And when I saw them, my answer would be, I'm very sorry. I believe you have Alzheimer's dementia. There's not much we can do. So now there's so much we can do. And it's really invigorating to know that it's working. So
on the preventive end.
Absolutely.
Yeah.
So take control.
Dr. Rany, award-winning neurologist and Chief Executive Officer of Neurogen Biomarking, thank you so much for joining us today. And we want to remind you about the event that's taking place this weekend. He said you're at 174, only 200 people they're taking, so you got to register quickly. It's Capturing Memories Community Brain Health Day, and it's this Saturday, June 21st. It's at Insight on South Saginaw Street near I-475 and Hemphill Road. It is free. It's from 10 a.m. until 3 p.m. They will offer the testing there, and food and parking also will be provided. We'll be right back.